Hello everyone, I am urologist Omar Makaya. The topic we will talk about today is chronic prostatitis. Chronic prostatitis is a chronic pelvic pain syndrome. It is a disease characterized by pain in any area in the lower abdomen, hip area, under the navel or perineal area, for example in the testicles, penis, or penis tip. Chronic pelvic pain, formerly known as chronic prostatitis, may also be accompanied by erectile or urinary complaints. When these patients normally come to the outpatient clinic, it is necessary to spend 3 to 4 times more time than other patients. The patient's complaints should be evaluated in great detail. In this disease, it is necessary to evaluate the patient's psychological state, lifestyle and diet. It is a very common disease in men under the age of 50, and it can have many causes. Chronic prostatitis can be caused by many reasons such as sexually transmitted diseases that the patient has previously caught and the patient's exposure to cold in the past. The cause may also be unknown. What is important is the patient's complaints, and pain is at the forefront of the patient's complaints. Many patients with chronic prostatitis have received antibiotic treatment, they have used alpha blocker group prostate medications. They have been on antibiotic treatment for months. The first 3 treatments I have described are the first treatments we apply to patients who present to the clinic with chronic prostatitis. If the patient comes to us again after receiving these treatments, we gradually start to call this condition chronic prostatitis. The most important feature of chronic prostatitis is that the patient's complaints relapse, exacerbate, and periodically complaints decrease. To put it very simply, chronic prostatitis is divided into bacterial and infectious or non-bacterial and non-infectious. I have made detailed videos about this before. And it is now easier to diagnose bacterial or viral sources than it used to be. Previously, we had culture tests. We were doing semen culture, prostate discharge culture or urine test culture. We were missing many bacteria, we could not identify them. But now there is a polymerase chain reaction test called multiplex PCR. In this test, about 30 bacteria and viral infections can be checked if desired. An antibiotic treatment can be organized accordingly. As I said, the most common treatment for chronic prostatic patients is antibiotics, painkillers and alpha blockers. In the past, when antibiotics were not so strong, there was a technique that tried to relieve the prostate by pressing the prostate from the anus through the prostate massage and allowing the secretion in the prostate to come out of the penis. Nowadays, I think prostate massages are becoming popular. Many scientific studies say that prostate massage has no benefit and many others say that it does. But there is a fact that some patients respond very well to prostate massage. Many patients said that they were much better after 3 or 4 sessions and that their pain decreased, the feeling as if they were sitting on a ball in that area decreased, and their swelling decreased. But prostate massage alone is not enough. What is our aim in prostate massage? The prostate organ is actually a gland that constantly produces secretions like the salivary gland. It produces enough secretions to make up about 90% of the volume of semen, and there are secretory ducts in it. There are hundreds of ducts and these ducts can be blocked by small stones and small particles. When it is blocked, it can cause pain in the patient in that area, or if there is an infection or bacterial condition in that area due to that blockage, it can cause pain in the patient. When we do the massage, we increase the blood supply of that area. We both activate the vascular nerve packets passing to the right and left of the prostate, and we also open the blocked channels in the prostate. Treatments such as neural therapy, shock wave therapy or ozone therapy can be added to this. Until 3 years ago, treatments such as shock wave therapy, neural therapy, prostate injections, ozone therapy were not practiced much. In the last 3 years, the results we have received from patients in shock wave, penile injections and neural therapy injections around the prostate have become pleasing. We started to get positive results in about 80% of patients. There are not many other disease groups where complementary therapies or complex treatment protocols are applied as much as chronic prostatitis. In chronic prostatitis, we need to wait for the result of the treatment we give to the patient. If he does not respond to the treatment, a different treatment protocol can be applied. What is neural therapy? To put it simply, neural therapy is an injection of procaine into the area where the prostate is, on the sides and on top of the prostate. Procaine is an anesthetic substance. We do not benefit from the anesthetic effect of procaine, but we try to benefit from its bioelectrical regulating effect on the nervous system. Neural therapy has been practiced in Europe for 80 years, especially in Germany. It is a method used especially for pain treatment. It can be used for pain in all parts of the body. When we give it in addition to prostate massage, we see that we get good results in patients. Thank you for listening. Best regards.